to another episode of Simply Healed, and with me today again is Dr. Jansen.
Hi Sean, hello everyone. Welcome to another episode of Simply Healed again. So tonight, we're going to be discussing prostate cancer.
Yes, as part of our Men's Health Awareness Month. So prostate cancer. So Doc, we've talked about prostate cancer before.
Yeah.
So maybe something new is that we noticed is that prostate cancer is the third most frequent cause of cancer among males, and it's been increasing like 120% over the last few years. So more and more men are getting prostate cancer, and more prostate cancer patients are actually dying.
Yes.
All right.
Yes.
So that means the survival rate for prostate cancer actually seems to be dropping, despite most other cancers actually are improving. So why is this the case? And what's your advice for us on how to protect ourselves from prostate cancer? And again, what's the prognosis? If you catch prostate cancer early, let's say stage 2, because stage 1 is really hard to discover, right? Let's say stage 2. What's the success rate?
For stage 2, it's still pretty high, at least 90%. Yeah, you're going to be able to live.
So don't allow prostate cancer to reach the fourth stage.
The fourth stage, yes.
All right, so let's go back to the original question. Doc, why is prostate cancer becoming more and more prevalent, and why is it getting more and more deadly?
A lot of factors, okay? So number one is the diet of males, of guys. So, you know, guys, we tend to eat more junk food.
He-Man only eat animal products.
Okay, so that's one of the reasons. Number two, we don't usually go for checkups. We don't usually go for prostate checkups, blood works. It's just the way it is. I think it's just the way men are wired. Okay. So of course, with less detection, eventually once you get diagnosed with you already have symptoms, you get diagnosed with prostate cancer. It's
already stage 3.
Yeah, it's going to be at an advanced stage already. Okay. So that's one of the reasons as well. And then mainly the diet. You know, the technology right now for treating prostate cancer is so advanced. And prostate cancer is highly treatable. Okay, but you know, how come more men are dying each year? So those are one of the reasons, no? Okay.
So don't let it spread.
Yeah, don't let it spread.
The moment it spreads, the treatment is a lot more complicated because it's now in your bones, in your liver.
Bones, yes.
Right.
And more problematic there is prostate cancer tends to metastasize to the bones, and you know, once cancer metastasizes to the bones, it's going to be painful. Okay.
Wow, and you know, men cannot handle pain. Women can handle pain.
Our pain tolerance are lower. Okay, and also if your prostate cancer doesn't metastasize to the bones, your prostate might increase in size so huge, so large, you'll have difficulty in urinating, have urinating symptoms already. Okay, which is really a very it decreases the quality of life. Quality of life is really so bad. Okay? Yeah.
So quick tip, because it's a topic we are familiar with, but let's a quick tip. How can we males make the greatest impact on preventing ourselves from getting prostate cancer?
Okay. Yeah.
What's the tip for that?
Okay, so we have to realize the risk factors for getting prostate cancer, and diet is the number one risk factor for this. No, okay. So what specific part of our diet is the one that giving us prostate cancer? It's dairy. Okay.
It's milk.
It's milk. Okay, dairy products. Your cheese, whey protein.
Whey protein.
Casein. Yeah, because whey is a derivative of milk.
Is that why maybe more men getting prostate cancer? Because a lot of us now are also health conscious.
Yeah.
Go to the gym.
Whey protein.
And we take a lot of whey protein.
Yeah, so
a lot.
Yeah, it's one of the reasons as well. Can be.
It could be. Maybe it is because there are a lot of brands of whey protein today compared to 20 years ago.
Exactly.
Yeah.
Okay,
so the demand is there.
For milk, how much is significant? Okay, so here's the result of one study. You know, so those consuming at least 2.5 servings of dairy products per day had a 34% greater risk of developing prostate cancer. Okay, versus those who consumed less than half a serving. Okay,
so don't take so much dairy if you are trying to wean off.
And if we translate this to glasses of milk per day, no? So those consuming more than 2 glasses of milk per day had 60% more prostate cancer than those who avoided milk altogether.
This is crazy. 2 glasses of milk,
Yeah.
and that's 60%
Yeah.
more prostate cancer than those who don't drink milk. That is
That is a huge number.
wow,
Okay.
wow.
That is a huge number.
That's a huge number.
Yeah,
All right, that's
yeah.
a huge number.
Okay, so even 1 drink a day increases the risk by 10% already, and the risk is significantly increases. The risk significantly increases with each additional drink. Okay, as what I have mentioned a while ago. Okay, so why does milk increases your risk of prostate cancer? It's because milk increases the IGF-1 level. So what is IGF-1?
What is IGF-1?
Okay, so IGF-1 is insulin-like growth factor 1.
Okay.
Okay.
Insulin-like growth factor 1.
Yeah, so
IGF-1.
this specific growth factor stimulates tumor growth. And this specific growth factor is very high where? In kids, in babies. Because why? They need to grow fast. Okay?
Alright,
So a baby this size should have to grow as an adult size, right?
Yeah,
so
3 times,
3 times
within
its size.
a year, right?
Yeah, within a few
Infant
years.
to
Okay?
1 year
So
old.
that's why they need this. Now, if you, as an adult, if you continue to drink milk or if you continue to consume dairy products, your IGF-1 level will increase. Okay? And if your IGF-1 level increase, your risk for cancer will also increase. Okay? So
Wow.
that is the link.
I mean, just as a sidetrack, you know, when men drink milk, right? Like when we take our whey protein, we are thinking to ourselves, I drink milk so that I will grow strong. But you know, have you ever considered? Have you seen a small calf? You know, a small cow. You know how a small cow grows into like a 200 kilogram cow in like 3 years, right? It takes us, a human being, look at your son, your daughter. How long did it take your daughter to grow from a toddler to a full-grown adult? It was 12 years, puberty,
Yeah,
right?
exactly.
But a cow, in 2 or 3 years, it will grow from like 20 kilograms to 200 kilograms.
Yeah.
So then again, so that means you are drinking something that makes a cow grow from 20 kilograms to 200 kilograms.
Exactly.
When human beings take 12 years to grow from
Yeah.
12
And
12 kilograms to 60 kilograms,
You know,
right?
it's really funny because we are the only species that drinks the milk of another species.
That's right. And here's the funny thing, right? Cows don't drink milk. Only baby cows,
Baby cows.
drink milk.
Yeah.
Grown cows
Baby
don't
cows.
drink milk,
Yeah.
right? So I was just speaking to a friend of mine who's lactose intolerant, and she was popping the lactose pill.
Yeah.
And I said to her, actually, you know what? Do you know that you're the normal one?
Yes,
And we are the
yes,
abnormal
yes.
one.
Asians are
We are supposed
innately
to be
lactose
lactose intolerant.
Yeah.
Okay, yeah. But you know, this just goes to show why cancer is so natural to us now. Because what was natural has become unnatural, and what's unnatural has become natural.
Yes,
Right.
exactly.
Yeah. So, Doc, prostate cancer. Any last tips and
Now,
information you want us to know?
So here's the good news, no? Even if you get diagnosed with prostate cancer, yes, it can be reversed. So how?
Wow.
Okay.
That's
So
good
here's
news.
a study by Dr. Dean Ornish. So Dr. Dean Ornish studied men with prostate cancer who were diagnosed at an early stage. Okay, so these men are actually on watchful waiting. So they are observing their prostate cancer if it grows large enough for them to undergo surgery or large enough for them to undergo treatment, radiation therapy or brachytherapy probably, you know. So they are watching they're in the observation stage. So while waiting, okay, they tried to change their diet, stress management, exercise, okay. They underwent this lifestyle program for 12 months, and lo and behold, this is the result of their PSA. Okay? Those who are on a standard American diet actually had their PSA increase. Okay? From this level to this level. Okay? And those who are on a plant-based diet actually decrease their PSA levels from this level to this level. Okay? So you can just imagine the discrepancy. Now, a PSA that decreases is a sign of cancer regression. Okay?
Not progression, regression, going backwards.
Okay, so going backwards is a sign of prostate cancer reversal. So Doc, what if I have an advanced stage prostate cancer already? So this research studied men with prostate cancer who already underwent radical prostatectomy. Now, if you are someone who underwent radical prostatectomy, that means your prostate cancer already invaded the nearby structures. Okay? So that is one of the criteria. So that is an advanced stage of prostate cancer. And once you undergo radical prostatectomy, yeah, they remove your prostate. So your PSA level should go to 0. Okay?
Because you no longer have.
Because you don't have the prostate already. All right. So the researchers studied these patients further. So now they compared their fiber intake, dietary fiber intake they compared their dietary intake with their PSA levels. So now these patients who had a high dietary fiber intake actually decreased their level of PSA. Okay, so mind you, these patients already had recurrence. Okay, so if you have recurrence, what will happen? Your PSA level will increase. Correct, because there are prostate cancer cells that were left inside your body. Okay, so recurrence, prostate PSA level increased. Okay, so some patients underwent high fiber intake, some patients had a low fiber intake. Okay, so those patients who had a high fiber intake had the PSA levels decrease again, and those who have inadequate fiber intake had PSA levels increase.
Why is that the case?
Yeah, it just goes to show, the diet, the food that we are eating has a big influence on whether on the progression or the regression of cancer. Okay, so why is this the case? It's because of the antioxidants, the nutrients, the phytonutrients inside the food that we are eating, and we are actually eliminating those foods which promotes cancer growth, like milk, like dairy. Okay, so it's just basically allowing the body to heal itself and not putting more injury to the body. Okay?
Doc, as you talk about this, and since we've been talking about lifestyle changes and in cancer for more than a year now, it just dawned upon me that lifestyle change is I'm looking at it that it's not so much sometimes that the vegetable that you eat is so good for you, because that's why we still need supplementation. I mean, that's why we still take supplements like Simply Nature pea powders or turmeric, right? Yeah, it's more, I think, like you stop putting nonsense into your body. It's like you can't exercise yourself. No matter how many sit-ups you do, you're never gonna get a six-pack.
Yeah.
What you have to do is you have to stop eating so much. That's the key to getting six packs, to getting good muscle tone. There's no way you can pump enough iron, do enough bench presses that your muscles will bulge. At the end of the day, all muscle builders, all those bodybuilders, before they go for competition, they are on actually very strict low calorie diet so that the muscles will show.
Yeah.
So sometimes, apart from the goodness of the vegetables, I think what is really effective is that you stop eating all these poisonous stuff in your body.
Exactly.
And that's why all these PSA levels drop. It may not be the goodness of the vegetables. It may be as simple as the absence of the toxicity of eating meat products, right?
Yeah.
Yeah.
Okay, so that's basically it. Of course, if you are someone who is diagnosed with prostate cancer right now, very important that you change your diet immediately. Avoid eating the foods which are prohibited for you. Okay, then we can already begin taking Simply Nature pea powders as a immunotherapy. Okay, because our immune system again has a big influence on fighting cancer.
And especially one that's so slow like prostate.
Yeah, exactly.
You really have a good chance.
You really have a good chance because prostate cancer is a slow-growing cancer, and it has been already proven time and time again that it can be reversed. Okay?
All right, so we'll go to our questions. Ask Me Anything segment. I'm sure you have questions beyond prostate cancer. And since this is Men's Health Awareness Month, anything that you want to ask, be it performance issues, right? That's linked to metabolic syndromes like diabetes.
Exactly.
All right, and we can help with answer those questions as well. All right, so without further ado, let's go to your questions.